Okay. Looks like we're live. Good morning, everybody, to the men and women of the 142nd Fighter Wing, family members. I'm Colonel Adam Sittler. I'm the 142nd Fighter Wing Commander. Thank you to those who have made some time today to dial into this live stream. This is new technology for the wing. It's new for me. I'm certainly optimistic it'll be effective, and I look forward to your feedback if this is helpful for you. I will say up front that this is intended to be informative. I'm trying to communicate to you what I know. I'll be very honest about what I don't know. I look forward to taking some questions and just getting a sense of what's on your mind. In terms of submitting questions, so on the webpage, if you look probably below my photo somewhere, you'll see there that if you have a Gmail account and if you've logged in to YouTube via that you can submit questions at any point. I'll be answering those in just a few moments. And you can go that way. If you don't have a Gmail account, we don't think you can submit questions directly onto the feed. So there's another link in there to an org box that's being monitored. So if you watch me at some point kind of glancing around, some of my staff is here. They're being extraordinarily helpful, and we'll answer other questions that don't come in direct onto the live stream page. I do want to say up front, a huge thank you to our Wing Public Affairs team, Mr. Stephen Conklin and his staff, who Steve's sitting on the other side of the computer here, but he's helped me out a ton to get this running, as well as to the Fighter Wing headquarters staff, and then our resiliency team. You'll hear me mention them many times. We have some great airmen here who are working on behalf of the members and the families in the wing, and I just couldn't thank them enough. A quick situation update. We currently in the 142nd are in health protection condition Charlie, or HPCon Charlie. For the military members, you're familiar with our force protection condition. For the family members who maybe are not as much, it starts on a lower end of the tier at normal or 0. Then we escalate from alpha, which is the next tier, to Bravo, which is more serious. And we're currently in health protection condition Charlie. I have a piece of paper here that lets us know that our risk level is substantial, and it means that there is sustained community transmission of COVID-19 going on in Northern Oregon, Southwest Washington, where the majority of our people live. And so by me declaring that we're in health protection condition Charlie, it starts to give us the right tools to message and to take measures to keep our airmen and their families safe. Some of the things in terms of current information, this is all publicly accessible. I don't have access to information that you all wouldn't as well through the Oregon Health Authority, et cetera. But in Oregon, in the last 24 hours, there have been 24 new lab-confirmed cases of COVID-19. That brings Oregon to 161 total cases. And in Washington, there have been 203 new cases for a total of 1,996 total cases. We know that in both states that there's not been widespread testing. And so we have taken a number of measures here on base, which are intended to proactively get ahead of a response where none of us in the 142nd or in the civilian community have access to perfect data to know exactly what we're dealing with, but we are definitely leaning forward to try to care for members and their families while keeping our missions going. In terms of measures that we've done on base, in terms of being in health protection condition Charlie, the first thing is, for those of you who have entered our installation in the last week, you notice that our defenders, the security forces members who will greet you at the gate, don't take your ID card. So we are trying to minimize any touching of a device like the common access card, and so they'll view your picture and do a scan without ever directly transferring that card. They'll also ask you, a series of questions. Are you experiencing a fever? Have you traveled anywhere in the last, CDC, Centers of Disease Control, declared a level 2 or 3 country in the last 24 hours, et cetera. The type of questions that would help us ideally catch and screen members who are going to enter the installation. We've made the installation mission essential only. So unfortunately, that means we've had to close our base exchange and a number of other services which we normally try to provide to our members, but we are focusing on just truly the folks who have to be here. We have widely encouraged telecom. The notice that I've given to the senior staff is I want us to telecommute to the max extent possible and take advantage of telework, so that way we can minimize, again, the total number of members who are here on the installation. I hope you're aware by now, but if not, let me clarify that this upcoming drill in April has been declared a flex drill. What a flex drill means is that effectively the wing is not going to drill. If there are critical tasks that have to be done, you will be contacted directly by your supervisor, and that supervisor will order you to come in. It'll be very limited airmen on very limited tasks, but by and large, the majority of the wing is not going to do a regularly scheduled drill in April. You'll have the opportunity to make up that drill sometime later on this month. I certainly hope you're all aware of this, but please allow me to reiterate the Centers for Disease Control best practices. So first and foremost, we start with social distancing, trying to keep all of our airmen, as well as those of you who are not on the installation, more than 6 feet away, covering coughs and sneezes, doing incredible hand hygiene, frequent hand washing, more than 20 seconds, and doing whatever you can to avoid being infected or continue to transmit COVID-19 to others. We are taking advantage, like I've mentioned, of our telework to try to limit the number of people here to the max extent possible and following all of those recommendations. I also want to publicly thank our public health team. Major Josiah Roldan, Captain Lee has been filling in there, Master Sergeant Jeanette, who's been doing some limited work and helping us from home, as she's doing with the bed rest situation, doing some great work for us. And of course, Chief Kennedy, also an outstanding airman in the 142nd Medical Group. They have been incredibly thorough, great advisors in helping us take the right path here within the 142nd. The last thing I'll mention up front, then I'll be ready to start taking questions from you all, is because we do not have robust testing in Northern Oregon and Southwest Washington, we're relying on you to communicate to your chain of command, your supervisor, what's happening in your family. I'll mention this, I'm sure, many times when I start to get to some questions. And what I mean by that is, if you are feeling ill in any way, but specifically in some of the common symptoms of COVID-19, like a fever, a dry cough, challenges in breathing, anything like that, you need to know that as soon as possible, and please contact us in addition to your primary healthcare provider before you start to travel around, and we'll come up with the appropriate measures to take for you at that point. That's for our military members as well as their families. We're relying on those communication chains to help us establish where there may be some higher concerns and some higher rates of infection within the organization, because we know there's just not robust enough testing yet for us to rapidly laboratory confirm all of our members who may be impacted by COVID-19 and ensure our missions and the health and welfare of their families by identifying that as soon as possible. Okay, in terms of questions, I'm ready to go to the questions now. Like I mentioned, this is new technology to me. I'm glancing at my screen. I don't see any yet, so I'm not sure if they're not there or if they just haven't flown, but I'm sure my staff members here will help me if you're trying to get questions to me. Just a reminder that we still have to abide by our operational security restrictions, and that's my way of saying there's certain things that I just may not be able to get into. This is a public forum. We will get you answers through your chain of command as best as we can to everything. And what I'll commit to you is if I run out of time to answer all your questions today, ideally we'll go another 30 to 40 minutes or so. And if we run out of time, that we will post answers onto our wing webpage. Also, on this link, you should see some resources. You'll see the 142nd fighterwing.ang.af.mil webpage. Right on the top of that, there's a COVID-19 resource area. And within 48 hours, so no later than noon on Wednesday, any questions that get asked in this forum that I haven't been able to address, we will post a written response to them there to make sure that we're addressing everything as best we can. Okay, so looks like I've got a mobile device here, which I'm going to try to read off of and address some questions that are coming in. And this one looks like, is the maintenance group continue to come into work truly mission essential? On weather closures, we are not considered essential. Okay, so that's a great question. Over the last week, we have tried to do a ton of different things that quite honestly sometimes conflicted with each other, because telework and distancing, which I think is kind of getting to the heart of this question, can certainly conflict with trying to have as many airmen here as possible to generate airplanes and to get our team out the door. And as many of you know, and so the best information I have right now is that deployment will continue. That is a federal tasking. And what I mean by a federal tasking is it is outside of the control of the state of Oregon, and our national level command authority are directing that those airmen will continue on that mission. We are incredibly mindful of public health. This morning I spoke to my commander, Brigadier General Donna Prigmore. I know she's in constant consultation with some higher headquarters agencies. The deployed commander for the first half of the rotation. We continue to gather information, and ultimately we're looking for the best public health reasonable means to take care of our airmen, both as they mobilize here at home station and then as we deploy that team downrange. And so to get to the heart of the question about, is this considered mission essential? For the time being, yes, mission essential to generate that force to deploy. Once we get our team deployed, now as we reassess mission essential, it will come down to our steady state missions on the installation, like aerospace control alert, which is our alert mission is something that will continue as we go through this process. And then we'll take a look at other activities and ensure that we're balancing the care for airmen and their families along with steady state operations. There's no question that COVID-19 has impacted our whole world, our state, and certain things have to change. So we cannot just continue to do everything, and mission essential will be part of that. So hopefully I was able to address that question. Another question I see here says, OPM says members who are essential should be notified annually, and we haven't had good communication on this subject. That's great feedback from me. I have not heard that before, and that's one that I will certainly take a look at with our senior staff and make sure that we are following OPM guidance and all of those rules and clearly communicating who's considered mission essential and things like that. So I'll commit to you to get back more in a second. Another question that I see here says, is there any discussion of the Oregon Air National Guard activating to help with the pandemic? Sounds like other states are activating their National Guard units. Okay, that's all that I have on the mobile device, so I'll hand it back to Mr. Conklin. But yes, so we are under discussions with state headquarters. If you have a chance to talk to the group commanders or group superintendents, they'll tell you there is a lot of communication going on. So far, it's primarily been data calls. What's possible? How can we help? Being mindful, specifically, let me address the medical group and the medical professionals, that if we bring medical professionals out of the civilian community to work to help in the military community, that takes maybe more of a regional, general, around the state medical response, and it starts to make it more localized wherever our members are deployed and are providing care. And so that is being balanced by the Adjutant General, Major General Mike Stencil, as well as Governor Brown's staff. And currently it is all in discussion stage. So at least in the Oregon Air National Guard 142nd Fighter Wing, at this time, I am not aware of any pending state activations. As the question referenced, the two states on either side of us, Washington and California, both have activated large segments of their National Guard. We will see if Oregon follows suit. At this time, I don't have any other information. Referencing a clipboard here, so that's where we are now on the next question. Will the medical group deploy to assist? I think I just referenced that question. Currently, no known tasking for the medical group. A question here about if we are having trouble connecting while teleworking, should we come in? That's a great question. So we, the Air National Guard, started last week with our virtual personal network, VPN. Not sure exactly what VPN stands for, but with that network supporting well less than 3,000 users. By the end of the week, it was supposed to expand to on the order of 7,500 users. And then I saw some information that it may expand into the 30,000. And that VPN access will allow members to effectively work from home with all of the tools that they would have on a government connected device from home, with all the tools they would have as if they were in their office. So access to our shared drives, and things like that. If members are doing things like email, now there are many other options. Going through the Air Force webpage, you can get to OWA, which again, I don't know exactly what that acronym stands for, I'm sorry, but it is an Outlook web-based application where there's the ability for members to track their email, and that should be much more accessible without using a VPN type of solution. And there is also a increased Air Force VPN solution, some information of which has gone out in the last week. What I will commit to you, as I said up front, that we will have an answer to this telcon, and part of that on our Wing webpage, which I guarantee you can get to as long as you can access the web without being government connected, and it will have instructions on there as to how to be more effective while working from home. Currently, my priority is to try to keep teleworking going. So we are willing to sort through significant information technology or IT challenges from home and continue to socially distance and keep members going there. And I'm certain that we will solve the IT challenges. So to address the heart of this question, I would much rather have members staying safe and socially distancing and teleworking to the max extent possible, and we'll solve the IT as we go. Will the Wing purchase their own testing kits? That's a great question. Right now, any testing capability is going to the most impacted, hardest hit areas, and that applies to us as well. One of the good things about this, I'm not sure there's much good about COVID-19, but one of the good things is that the majority of our base populace are younger members who are generally physically fit, and this disease has shown, as it's developed in a lower respiratory infection, to not be nearly as harmful, at least in terms of fatalities, on a younger segment of the population. And so therefore the crucial testing is primarily going to those hardest hit civilian areas that need that to save lives. Should we develop some more robust testing capability? It's something I'm very interested in. And we have looked at things like we've procured 2 handheld thermal scanners to take temperatures. We're still working on the best way to incorporate those into some of our concept of operations. But they're somewhat effective, but I don't want to oversell that. They are not a lab-confirmed COVID-19 test, which is the gold standard to try to determine who in fact is impacted by this disease. In the meantime, we think that our best measure is those prudent family members to sequester yourselves as best you can at home, practice the CDC guidelines I talked about, and then if you're not feeling well, to just avoid putting yourselves in a position to spread the disease to others. That's the best we've got this time in terms of testing. See a question here about, is the air control squadron considered mission essential at this point? I will have to work through the operations group commander. I have not considered that question yet, so I don't have a great answer. I don't want to mislead you with something right off the cuff here, if you will, without fully considering it. And so we will work that through the chain of command. And for Lieutenant Colonel Ashley Nowak, who I know is fully engaged and looking out for the health and welfare of her members there in the 116th Air Control Squadron, we'll get you that answer as soon as I can. So I appreciate that. Okay, I see Mr. Conklin is fiercely scribbling me another question. So 1 second. Okay. How do we maintain grooming standards with barbers shut down? It's another really good question. I considered that myself. I don't know if now's a great time for humor, but I got a 14-year-old kid, and I thought about letting him cut my hair, which that's maybe what it would come to for me. I happen to have a kit like that at home. But for those of you who maybe don't have the ability to get that done at home, we'll look at that through the chain of command. I think the answer to your question is we have to make some sacrifices. And so if that's something where maybe some of us are going to get a little bit shaggy due to concerns with barbering, that we'll cross those bridges on a case-by-case basis when we come to it, versus subjecting the force to more concern by being out there more in the community and less social distancing through a barber. Okay. Okay, I've got, I will publicly say who this is. So phone a friend, my Air Force Academy classmate and a great commander for me, Mission Support Group Commander Colonel Chris Lantain, is transferring acronyms. So thank you, Colonel Lantain. VPN is Virtual Private Network, and OWA stands for Outlook on the Web. So thank you, Chris. Okay, I see a note here that says Governor Kate Brown issued a stay-at-home order today. How does this apply to technicians and AGR members? I hadn't actually seen that, so that is news to me. So I will make sure to clarify that through higher headquarters. I didn't know that Governor Brown was going to take that action. And so as we clarify that, I do know that we have already asked the question, and we have certain mission essential activities that will continue, but I feel like there have been a number of questions. It helps to highlight to me that there's some confusion on what exactly mission essential means, how we best communicate that. And so what I commit to you is to circle back around and through the chain of command to address exactly who is mission essential. I can tell you this for sure, that the Oregon Air National Guard, the 142nd, will continue to operate throughout this. We are going to take prudent measures, but there will always be someone here on this installation at the bare minimum to support our alert mission, and we'll look at other activities as we go. Okay, a question here about, does the wing or the Oregon Air National Guard have any resources for members who may be out of work right now or experiencing financial hardship? That's a great question. Really, really concerned about that, tremendously concerned about it. And so here's my answer to that question, and I'm sure 1,000 others that have to do with members who are experiencing tremendous hardship right now on a number of fronts. The first and the most important thing to me is to engage with your first level supervisor. I need you to make sure that the chain of command here in the wing is tracking your unique situation, whatever's impacting you, and the specifics of that situation. It's hard for me to put out a blanket, here's what we do for members who may be out of work, childcare issues, or whatever it is that may have potentially turned your world upside down. But what I can commit to you is once the wing knows about it through your chain of command, now we will act on it, we will communicate back to you, and we will do what we can as a state, as an organization, to care for members and their families. And so in terms of any financial hardship, once the chain of command is aware, now they'll work that up to and through the squadron commander or the flight commander level, depending on the organizations. We have a number of flights and squadrons within the wing, but that first command level within the organization, it's imperative to me that the commanders are in the loop and they know what's going on for their members. We'll also cross-reference to Airmen and Family Readiness. Our Airmen and Family Readiness team are a great group of individuals, Mr. Frank Fay, Ms. Renee, Senior Master Sergeant Amy Allman-Schmidt, and then they also cross-reference out of Airmen and Family Readiness with our whole resiliency team, which includes our chaplains, our DPH, our financial planner. We have resources at the state. Our first sergeants, of course, are going to be involved in this throughout with the chain of command. And so once those airmen are engaged and involved, now we can start to look at what's available based on where the member lives, what resources are there, being mindful that what's impacting us is impacting everyone in Oregon, everyone in Southwest Washington, that we're all in this together. Nobody's untouched by this. And that's my way of saying that some of the resources that would normally be available to a one-person, two-person who are experiencing a hardship, it's going to be more of a challenge now than it was before. It's got to start with supervisory engagement, now cross-referencing to that wonderful team of airmen who are there to help other airmen, and then we'll go from there. We'll solve this on a case-by-case basis. Okay, a question here. Will the employers have scheduled time off before the movement? Between the generation and weekend duty, we've had little time to prepare our personal lives. That's a great question. As I mentioned before, I think I answered another question, and I highlighted that this is extraordinary times. As the question referenced, we had some airmen here, primarily from our 142nd Maintenance Group, who worked through the weekend, generating airplanes. Generating for our civilian and family members is the term to get them ready to fly and to go deploy to And so reference the question I just read. Yes, I spoke with Colonel Kopp yesterday. I know he is desperately looking to create some space for members to have some time to take care of personal affairs. We're also looking to develop that socially distanced time. We call it a sequester, and that sequester time to try to build in some more resilience in terms of public health for our force before we mobilize and deploy. And so it's not a blanket. I can't promise each and every member, but I know that certainly starting at the group command level all the way down, we are looking to develop some time to get personal affairs in order before the team starts to deploy with first our advanced party, then some airmen who are going to catch the airplanes when they arrive, then our main movement, our main body, and find the airmen coming up over the next week or so. Okay. Okay, a question about, are we authorized to wear face masks at work? Okay, so public health has done, again, a masterful job to educate me and to communicate a lot of things to me. So I'm not by nature a public health person, but I've learned a ton over the last few weeks, as I'm sure many of you watching from home have as well. Everything that I have read is that the face masks are really intended for those who are sick, because this is a respiratory disease. COVID-19 is spread primarily by somebody who is sick, coughing or sneezing, and then other members either getting that because they're inside of that 6-foot distance, touching a surface that maybe they coughed or sneezed on, and then touching their face in some means or another. And so the mask, if it's looked at as a preemptive measure to avoid others from getting sick, everything that I've heard from public health is they don't really help to do that. In fact, now there's just an obstruction on your face that you're probably not used to, which may cause you to touch it more, and it's not as helpful as all the other measures that I've mentioned a number of times, starting with social distancing and solid hand hygiene, staying away from touching your eyes, nose, mouth, etc., to spread the disease. In addition, for the really high-end masks, those we are desperately trying, we as Americans are trying to preserve those for those amazing men and women who are working in our healthcare facilities and caring for, a number of our fellow citizens who are sick. And so that's part of my, plea that we don't hoard any of those type of supplies and try to let them for the folks who desperately need them. If somebody is sick, so kind of my last answer to this question, in coughing or sneezing, now you just need to stay home. So please do not come to the installation at home. Again, please consult with your primary care provider, etc. And I think they're better suited than I to talk about ways to protect your family members and other loved ones who you may reside with, so that way you don't spread, if you are feeling symptomatic, anything to your family. Okay, anything else? I see a question here. I'm not sure if I totally understand it, but any advice on balancing Washington resident requirements and Oregon requirements? And I'm not sure I 100% understand what that means, but I do recognize that we have a number of our members in the wing who live in Southwest Washington. The question is, maybe the governors will have slightly different rules or restrictions or anything like that that's happening within their state. I know for sure that we'll still have freedom of movement between the two states, even as we go towards a mission essential thing. As I've said numerous times, we'll continue to operate and we'll ensure safe passage for our members back and forth. Beyond that, I'm sorry, I'm not sure if I fully understood that question. So the person who submitted, if you could clarify a little bit more through one of the org boxes, I think maybe that could address it more thoroughly. Okay, I see in here some concerns about HIPAA, talking about prevents us from identifying any affected individual by name. Again, HIPAA is an acronym. I'm not sure I can get all the way through, but as a commander here within the 142nd, we deal with HIPAA all the time, and the idea is that health information, records, things like that is incredibly personal. And we manage HIPAA appropriately, and so the idea would be that members should be communicating with their chain of command. Once it gets to a commander, commanders are authorized to access that information. Trust me, there's not going to be a public-facing list of members, family members, what they're dealing with, any underlying health conditions, etc. That is clearly personal business and not in the interest of the organization. In this capacity, what we need in terms of the military members is to get a sense of how many people are feeling symptomatic, what are the results of their COVID-19 tests, and that will be handled appropriately in accordance with the channels. If I address that, okay. Any other questions for me? I think I answered that one. Sorry for the technology glitch. Ultimately, I'm looking at my screen here. I can see myself, but I can't see any questions. So we'll figure that out, but questions are getting handed over to me. Okay. Okay, I see a question here. Are we going to be ordered to shelter in place in Oregon? And how does that affect Washington residents? That may have been the question I just tried to answer a little bit before. What I could tell you about that is each governor, so Governor Brown here in our state, Governor Inslee in Washington, they have the authority for law and order within their state. They'll make decisions, and those decisions may be independent from each other. As those things happen, because we have residents of both states who work here in the 142nd, we will continue our mission. So hopefully I was able to address that okay. Okay, I need drill pay to support my family. Can I telework over the April drill? The answer to that is work it through your chain of command. I think there are many activities that can be done, be it if you're trying to finish up some administrative tasks, maybe a test that you have coming up, you're studying for a skill level upgrade or something like that. You may have, if you're more of a supervisory position, maybe some performance reports. I can go on and on with administrative tasks. So work that through your supervisor. We do have the ability to work remotely, like I've said many times for the full-time staff. That would apply for our drill status members as well. So to me, it's not a blanket yes or no because I don't know your individual situation, but your supervisor does. That can be routed through the commander. And if there are concerns about that, absolutely, that is definitely something that is in the realm of possible to do a rescheduled drill and to make that up in an alternate work location as long as you're accomplishing the meaningful tasks. Okay, I see a question here about will our current deployers be able to come home as scheduled or will they be delayed? I assume that is primarily associated with the 116th Air Control Squadron. They are by far our most deployed members right now. They are in the United States Central Command Air Responsibility, which for the family members, U.S. Central Command basically means the larger Middle East still. That's where the Air Control Squadron folks are. The best answer to that question is right now, I don't know, and I truly am not sure that anybody knows. That may not be a satisfying answer, but that's the truth. I tell you who will know and who will communicate to you, both the military members and the family members as soon as possible, is the unit commander. That's Lieutenant Colonel Ashley Nowak. I mentioned her name before. Amazing commander. I know she's highly engaged with her deployed team and then communicating to family members who are behind, who are key volunteers in our Airmen and Family Readiness. And as soon as we have substantive information on that, we will share it as soon as we can. I don't have any other details on our Air Control Squadron members at this time. Okay. What was jotted to me here is just to make sure you know that it sounds like in trying to manage this, because I can't see all the questions, my understanding is there's more questions on the feed than I was able to address. I just want to reiterate that we will answer all of them. If it didn't make it to me today, I'm not skipping the hard ones, I promise. And we will post a written response, as I've already mentioned, it'll be up there no later than noon on Wednesday. And if that doesn't answer your question, then push it back through the chain of command. Leaders are going to lead. So for our amazing NCOs that we have within this organization, we're going to tackle those tough issues head on. We'll push them up the chain of command. We'll do our best we can to answer each and everything for you. Steve, anything else coming in on the feed? Okay. Steve's trying to gather a question, so I guess I'll just say that I'll wait and see if I get another question or two here in a couple of minutes. I just again want to thank each and every one of you for dialing in. I'm not super great at technology, but it looks to me like we have potentially 300 individuals on this live stream. I hope this was informative. I definitely will be open for your feedback if I was able to answer more questions, maybe dispel some rumors, and hopefully more than anything, just give you all a sense that we're in this together. I mean that sincerely, because I have a family, as many of you do too, and I'm incredibly concerned about their health and welfare. And I consider, it's not a cliche, that the 1,000+ men and women who are part of the 142nd are incredibly important to me. They're my family members too, and we're doing the best we can to care for our members while executing our missions, recognizing that that's what we're here for. That's what we do. We're trying to operate as sensibly as possible. Okay. I'll make these my last questions, and then I'll wrap it up after this. So let me see. This says, if and when it comes down to essential employees, will Title V civilian technicians be considered essential, and will that be based on their duties here? I have tried to address this a couple times, and I don't know if I'm going to necessarily add a ton more. I will say that Title V employees do some amazing work, and I don't think it's going to be as simple as saying yes, mission essential. Likewise, I don't think it's as simple as saying no. We're going to have to look at that on a case-by-case basis. Like I mentioned to you before, what I commit is we will do better on defining exactly what mission essential means, how we communicate that, following our state human resources rules, and I have that for action. I will circle back to you as soon as I can get a satisfactory answer. So I don't think I have a ton more to add on that. Okay, I think that is it. Thank you. I've already kind of wrapped up and given you that. I don't have a ton more to add. If I missed your question, try to address that. If there's something that you didn't get a chance to address, the org box, I think the Gmail typing onto the page will go blank here once I shut down the stream, but the org box will not. So continue to forward questions there. And as always, I cannot foot stomp it enough that most issues are going to be fixed most effectively at the lowest level. Supervisors are going to supervise and lead. Commanders at the unit level are going to command. They're going to fix these things, but we have to know they're there. So please continue to communicate with those folks, and thanks for your service. I appreciate it. I hope everybody has a great day, and thanks for tuning in today. Thank you.